Hello everyone. The topic of this video is posterior triangle of neck. The question usually asked from this topic is either a short note on posterior triangle, or you are asked to enumerate the contents of the posterior triangle or one of its subdivisions. Now when you get a short note on posterior triangle, you should write your answer under the following headings. You start with a brief introduction, then describe the boundaries and write the subdivisions of the posterior triangle, then structures present in the roof of triangle, muscles which form the floor of the triangle, contents of the posterior triangle and the relevant applied aspect. So we start with the introduction. In this diagram, you can see this is the side of the neck. It is roughly quadrilateral in shape and is divided into two triangles by this muscle, that is sternocleidomastoid, which is running obliquely. The triangle which is anterior to the sternocleidomastoid till the midline of the neck is the anterior triangle. The triangle which lies behind the sternocleidomastoid but in front of a muscle which is present in the back, that is trapezius, this triangle is known as posterior triangle. So we have two posterior triangles and two anterior triangles in the neck. So posterior triangle is a triangular area on the side of the neck behind the sternocleidomastoid muscle and in front of trapezius muscle. Let us look at the boundaries of the triangle. It is triangular in shape, so it will have three sides and an apex. So let us look at the sides here. The anterior boundary of the triangle will be formed by posterior border of sternocleidomastoid. This is sternocleidomastoid muscle. This is its anterior border and this is the posterior border. So this is forming the boundary. Then posterior boundary is formed by anterior border of trapezius muscle. And the lower boundary, which is known as base also. The inferior boundary is also known as base. This is formed by middle 1/3 of the clavicle. And the apex, which is directed upwards, this is present at the meeting point of the sternocleidomastoid and the trapezius muscle. Now, what are the subdivisions of posterior triangle? Posterior triangle is divided into two triangles by the presence of the small muscle which is known as inferior belly of omohyoid. So this muscle will also have a superior belly which is present in the anterior triangle, and look at the name omohyoid. Hyoid, it will be attached to the hyoid bone here, and posteriorly it is attached to the scapula. So which muscle divides the posterior triangle into two parts? It is the inferior belly of omohyoid. This muscle will divide. Now the upper triangle, right, which is towards the occipital region, and it will contain an artery known as occipital artery. This is much larger. This is occipital triangle. The lower one, which is smaller also, and it will contain subclavian artery. This is known as subclavian triangle. This triangle, because it is present above the middle third of the clavicle, is also known as supraclavicular triangle. So the two triangles are occipital above, subclavian below, which is also known as supraclavicular triangle. And which muscle divides it into two parts? Inferior belly of omohyoid. Now let us look at the structures in the roof of the posterior triangle. So what we have to remember is this triangle is formed, its floor will be formed by the muscles, and the roof will be formed by which structures? The skin will be there, superficial fascia will be there, and then deep fascia will be also there. So skin, superficial fascia, which will be containing certain structures like muscle, cutaneous nerves, veins, that will be present. And then we will have the deep fascia, right? After deep fascia, we will have the contents of the triangle, and then we will have the floor which will be formed by muscles. So let us start here. The roof skin has been removed. Then what do we have? Superficial fascia, which contains here a muscle, right? That is platysma. Usually the muscles are present deep to the deep fascia, but in face where we don't have the deep fascia, and in the neck we have a muscle which is present in the superficial fascia known as platysma. All these muscles are remnant of pedunculus carnosus. What else is present here now? Let us see. We will also have 4 cutaneous nerves now. These cutaneous nerves, they will be branches of cervical plexus. So let us see which nerves will be there. To give you a brief idea how to remember this, what you are going to do is you will start from the occipital region. So that way you'll remember the names also. So first occipital, try to remember that. Then auricle, try to remember that. Then the neck here, right? And then comes the clavicle. So if you remember these 4 names, you will remember the names of the nerves also. So let us look at the nerves. As I said, first is towards the occipital region. So that is lesser occipital. Second is going towards the ear, right? This is great auricle. This crosses, right? The sternocleidomastoid divides into anterior and posterior division, whereas lesser occipital is going to run along the posterior border of the sternocleidomastoid. The third nerve, remember neck, I told you, will be running transversely, right? And will be going to the anterior triangle of the neck to supply the skin there, and will divide into an ascending and a descending branch. So this is transverse cutaneous nerve of neck. And finally we come towards the clavicle. So what do we call? These nerves are coming above the clavicle, so we call them as supraclavicular nerves. And how many supraclavicular nerves are there? 3. And these are the lateral, intermediate and the medial. Right? So these are supraclavicular nerves. So after this, what else do we have in the superficial fascia? We have a vein. And which is that vein? That vein is the external jugular vein. So lower part of external jugular vein, that is present in the roof of the posterior triangle. And this vein is formed here, right, behind the angle of the mandible by joining of posterior auricular vein and posterior division of retromandibular vein. This vein, external jugular vein, that will drain here into subclavian vein. And you will find the 2 tributaries also here, which we will discuss later on, right? So these are the structure. Then last structure, what is there, right? Then we have the investing layer of deep cervical fascia. So let's once again revise the structures in the roof. They are, first is skin, then we have superficial fascia, and then we have the investing layer of deep cervical fascia. Now you have to include certain structures in the superficial fascia. They are which muscle? Platysma. How many cutaneous nerves? 4. Lesser occipital, great auricular, transverse cervical or transverse cutaneous nerve of neck, and supraclavicular. Which vein? External jugular vein. Let us now see the muscles that form floor of the posterior triangle. So here we can see there are 4 muscles which will be forming the floor of the posterior triangle, and they will be covered by prevertebral layer of deep cervical fascia. So from above downwards, if we see, these muscles are semispinalis capitis, right? So you remember, because you are going towards the head, the upper 2 muscles, they will have this name, that is capitis in them. So semispinalis capitis, then splenius capitis, then levator scapulae, right, which will elevate scapula. And then we have the scalenus medius. Actually, there are 2 more muscles. Just deep to that, we have the scalenus posterior, and here behind the sternocleidomastoid, we have scalenus anterior. But these scaleni, they do not form the floor because they are hidden, right? So these are the 4 muscles. Shall I repeat once again? From above downwards, they are semispinalis capitis, splenius capitis, levator scapulae, and scalenus medius muscle. Let's now consider the contents of the posterior triangle. So first we will consider blood vessels, then nerves, then lymph nodes, right? So let us start with the blood vessels. Which blood vessels will be present? We will also see which blood vessels will be present in occipital triangle and in the subclavian triangle, so that if you are asked a question about the contents of either occipital or subclavian, you can write that also, right? So let us start with the occipital triangle. Which blood vessel will be there? You will have an artery there. That artery is occipital artery, right? So it's simple to remember, occipital triangle, which artery? Occipital artery. Let us see the vessels present in the subclavian triangle. So here we will have, as the name suggests, subclavian artery and subclavian vein. But which parts? The third part, because subclavian artery is divided into three parts. First, second and third, right? So it will be the third part of the subclavian artery which will be lying in the subclavian triangle or posterior triangle, and anterior to that you can see the subclavian vein. Which other blood vessels we will have? We will have transverse cervical artery and vein, right? Running transversely here, going to the scapular region. And then we have the suprascapular artery and vein. These are the suprascapular artery and vein. These two arteries, the transverse cervical and suprascapular artery, they are actually branch of a trunk known as thyrocervical trunk, right, which will give inferior thyroid artery three branches: inferior thyroid artery, transverse cervical and suprascapular artery. And the thyrocervical trunk itself is a branch of first part of the subclavian artery. I hope you will remember. And then what we have now the terminal part of external jugular vein, which drains into the subclavian vein. So let us see here which vessels are present. It's simple to remember. In occipital triangle, occipital artery. In subclavian triangle, subclavian artery, third part, and the subclavian vein. Then transverse cervical artery and vein, suprascapular artery and vein, and terminal part of external jugular vein. The transverse cervical artery and vein, some of the books will mention as contents of occipital triangle also, because they begin in the subclavian triangle and then reach the occipital triangle. Now let us look at the nerves. First we will see in the occipital triangle which nerves are there. So let us look at them. The most important nerve which is present here is the spinal accessory nerve, the spinal root of accessory nerve, which actually is going to supply these two muscles, that is sternocleidomastoid and the trapezius. These are the only two muscles supplied by spinal root of accessory nerve. And this you can see here is running here downwards, right, towards the downwards and laterally towards the trapezius. So first nerve is this one. Then what do we have? Those four cutaneous branches. Remember those four cutaneous branches? So first is lesser occipital, then second is great auricular, then third is transverse cutaneous nerve of neck, and the fourth is the supraclavicular nerve. So here the origin of these nerves, they form the content of the posterior triangle, and their further course, they will pierce the deep fascia. Their further course will be in the roof of the posterior triangle. So that's why they are included both in the roof as well as content, right? And then what else we have? We have some more nerves. You can see two nerves here. They will be coming from C3 and C4 spinal nerves, and they will be providing proprioceptive branches to levator scapulae and to the trapezius muscle. So these are the nerves present in the occipital triangle of the occipital triangle part of the posterior triangle. So I hope you remember the most important will be spinal accessory, then four cutaneous, that way you'll remember, and then proprioceptive, right? Muscular branches also you should remember, the proprioceptive branches to levator scapulae and trapezius. Now let us see in the subclavian triangle which nerves are present. So here actually we will be having brachial plexus, right? So you can see here these are the trunks, three trunks of brachial plexus, upper trunk, middle trunk and the lower trunk. There are three trunks of the brachial plexus, plus there will be some branches from the brachial plexus, usually from the roots of the brachial plexus and the trunk. So there are two branches from the roots of the brachial plexus, they will be also present in this triangle, and there are two branches from the upper trunk of the brachial plexus. This is the upper trunk, they will be also present there. So how many branches? In total, four. So three trunks of brachial plexus and four branches, two directly from the roots and two from the upper trunk. So let us see these. So first will be the dorsal scapular nerve. This is from C5 root, right? The fifth spinal nerve, ventral rami of C5. And then we have another one which is going behind the trunks of the brachial plexus down. It runs on the lateral wall of the thorax, supplies very important muscle, that is the serratus anterior. This is long thoracic nerve. The name itself suggests long and going to the thoracic region. So this is from C5, C6 and C7, long thoracic nerve. These are from roots of the brachial plexus. Then we have two branches from the upper trunk, right? Only two branches arise. First is which will supply the subclavius muscle here deep to the clavicle there, right? That is present on the under surface of the clavicle. This is known as, the first is the suprascapular is shown. So this is known as nerve to subclavius. Okay. Then another one which goes to the scapular region. This you can see here. This is the suprascapular nerve. So it is easy to remember. The nerves in the occipital triangle, which nerve you are going to remember? The nerve that supplies the sternocleidomastoid and trapezius, that is axillary nerve. Then in this part you will remember branches of which plexus? Cervical plexus. And which branches are coming? There will be proprioceptive branches from the cervical plexus and there will be cutaneous branches from the cervical plexus. How many cutaneous branches? 4. And how many proprioceptive branches? 2 to the levator, scapulae and trapezius. When you come to the subclavian part, there what you are going to remember? Here you will remember brachial plexus. Right? There you remembered cervical plexus. So you have trunks of brachial plexus and how many? Again 4 nerves. Right? And these 4 nerves, they are 2 from the roots, 2 from the upper trunk, dorsal scapular, long thoracic, from roots, from upper trunk, nerve to subclavius and suprascapular nerve. I hope you remember now. So these are the nerves. What we have some lymph nodes also, right? So you can see one at all these lymph nodes, they will be lying along the posterior border of the sternocleidomastoid, right? That's one thing you must remember. One is present at the apex, second is present in the middle, and third is present towards the base. So this one will be known as, this group of lymph nodes will be known as occipital lymph nodes. This middle one which is present, this is very important. So these are the lymph nodes which are very close to spinal accessory nerves. Sometimes if there is any carcinoma or any tumor and these lymph nodes need to be removed, one has to be very particular not to injure the spinal accessory nerve. And then one we have here near the base of the posterior triangle. These are also again very important. I'll tell you about the clinical aspect. These are the supraclavicular nodes. On the left side, they are also known as Virchow's nodes, right? Their clinical significance, I'll tell you a little later. So these are the lymph nodes that are present in the posterior triangle. Now coming to applied anatomy, right? So what happens? Sometimes there is tuberculosis of the cervical vertebrae and the pus will arise. Now this pus may trickle down to the axilla or to the medial aspect of the arm also, right? So there also it can form an eruption, right? So pus in the posterior triangle arising from tubercular cervical vertebra may track downwards in the axilla or up till the arm. Why? What is the reason for this? The reason is that the pus that arises in the tubercular cervical vertebra, it can pass deep to the prevertebral fascia. So it can pass deep to the prevertebral fascia just on the muscles which are forming the floor, right? So just deep to that, this pus will trickle down in the posterior triangle first. And then what happens? This prevertebral fascia, that forms an extension, because remember you have the subclavian vessels there and the trunks of the brachial plexus. So they will be enclosed in this fascia, and when these vessels, the subclavian vessels, they reach the axilla, you start calling them as axillary vessels. Plus you also have here the brachial plexus cords, right? So all these are enclosed in a sheath which is known as axillary sheath, and it is derived from prevertebral fascia. So from the floor of the posterior triangle, now the pus will track down laterally along the axillary sheath and it will appear in the axilla or even in the medial aspect of the arm. So this happens because prevertebral fascia extends around brachial plexus and axillary artery, because around the vein the sheath is very thin. right, which is continuation of subclavian artery as axillary sheath, right? So this is very important. You must remember. Now, as I said earlier, the left supraclavicular lymph nodes, remember near the base of the posterior triangle, which are known as Virchow's nodes, they are very important because they may get enlarged in cancer of abdominal organs or lung or memory gland, right? So, in case of cancer from stomach, colon, testes, lung, mammary gland, these lymph nodes may get enlarged. So why do they get enlarged? Because malignant cells, they reach via thoracic duct. Remember, the thoracic duct that drains on the left side at the junction of left internal jugular vein and the left subclavian vein. And these group of lymph nodes also drain. They also form a tributary and drain in the thoracic duct. So the malignant cells can reach the supraclavicular lymph nodes and get enlarged. Now, how can one stop bleeding if there is laceration of axillary or brachial artery in the arm? So for that, what one can do is one can compress the subclavian artery, because axillary artery is continuation of subclavian artery and brachial artery is continuation of axillary artery. So you cannot compress them, right, easily, but you can compress the subclavian artery downwards and backwards in the posterior triangle against first rib. Right. So at the base of the posterior triangle, you compress the subclavian artery downwards and backwards against the first rib. That's how you can stop the bleeding. Then, as I said earlier, injury to spinal accessory nerve. It can occur in a surgery which requires the removal or biopsy of lymph nodes in the posterior triangle of the neck, especially present at the middle of the posterior border of sternocleidomastoid, right? This group of lymph nodes is present just around the spinal accessory nerve, so care has to be taken. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.